People with aging problem has high propensity to develop infections or get infections or cancer. This is Dr. Dorwin Lajot. Outstanding morning. Assalamualaikum. And I have good news for you and updates and breaking news for you to be updated about not just the coronavirus but also person with disability, person with aging problem will get infections. And this will help us and also guide us to avoid and not to panic with this coronavirus threat. Okay, are you ready? Now, here is the news given to us by Oro Chamber of Commerce from the World Health Organization about Coronavirus Disease 2019 COVID-19 Situation Report. Okay, now this talks about the situation in numbers, affected countries and where this coronavirus is heading and going, and it's giving fear to person. According to the Webster Dictionary, that virus is something that affect your mind and your soul. What is important in this video today is that I'm going to tell you about the people, about person who will be or who will get be affected by this coronavirus. This is very important. Ito po ang pinaka-importante ngayon, not just the coronavirus because it's already spreading and almost around the world, and what you should know and what we should know and what is our part to also inform, and we can give just minimal motivation to stay alert and to stay focused on things that can help you. Do not focus on things that will expand and will just give problem to your mind and to your soul, right? Okay. Now, this is not just not the end of the world, but let's see. Only Allah knows, only God knows, right? So, based on this report given to us from the reliable source, especially from the Oro Chamber in this in our city, Cagayan de Oro City, that there is a suspect case, probable cause for home testing for COVID is inclusive, okay, being the result of the test reported by the laboratory. A person with laboratory confirmation of COVID infection. So, yung mga na-confirm na and mga probable case pa, okay, i-identify yon by the authorities. So, yung mga suspect case is patient with acute respiratory illness, like person with fever and at least one symptom of respiratory disease. Example, yung meron kang cough, nag-uubo ka ngayon, shortness of breath. Okay, before the coronavirus threat, meron ka ng ganitong problem and with no other etiology, meaning history that fully explains the clinical presentation. And a history of travel. So, meron kang ganito na mga history or to residents in a country with coronavirus threat or local transmission during 14 days prior to the symptom onset. Patient with any acute respiratory illness and having been in contact with a confirmed or probable COVID-19 case, okay, in the last 14 days prior to onset symptoms. Okay, a patient with severe acute respiratory infections like mayroong fever and at least one symptoms, yun ang mga suspect case. Alright? So, yung mga na-confirm na from the laboratory, isa din yun. Okay? And ito yung recommendation for the public. Okay? I'll be reading this because maybe not most of us or all of us have this copy, and some people are just getting like what they're saying, fake news, right? Sinasabi nila na fake news siguro to. Fake news. Okay, para hindi siya ma-fake news, okay, this is the recommendation of the World Health Organization. If you are not, okay, take note, in the area where COVID-19 is spreading or have not traveled from an area where COVID-19 is spreading, o hindi ka nakapunta ng area na merong coronavirus, okay, your risk of infection is low. So it is understandable that you may feel anxious according to this report, about the outbreak. So you need to visit or get the facts from reliable sources to help you accurately or determine your risk. Okay? So seek guidance from the World Health Organization office or from the healthcare provider, your National Public Health Advisory Authority. You need to see like this, okay, from the health authority or employer, or accurate information on accurate information on COVID-19, okay, whether COVID-19 is circulating in your area. So it is important to be informed of the situation and take appropriate measures, okay, to protect yourself and your family. Now, how about if you are in the area where there are cases of COVID-19? So you also need to take risk of infection seriously. When you have that symptoms, okay, so follow the advice of the World Health Organization and guidance issued by the national, especially in our country. President Duterte also already made a health emergency, public health emergency. So for most people, COVID-19 infection will cause mild illness. However, it can make some people very ill, and some people it can be fatal. Now, take note, older people and those with pre-existing, we mentioned earlier, like respiratory problem, and people with chronic illnesses like diabetes, heart disease, and etc. Okay, pre-existing medical conditions are at risk, according to this report, for severe diseases or disease. Okay, so you need to have a precaution with this. Okay. And you need to know where you have visited. If you have this kind of problem, chronic problem, heart disease or respiratory problem, check your history. Okay, where did you go 14 days earlier? Okay, you need to check that if you have visited a place where COVID-19 is there. Okay, so I think that's very important. Now, what we like to mention here is if you have problem like chronic diseases, chronic diseases like they mentioned the cardiovascular disease and respiratory problem. If you're older, okay, from according to the given report, from I think 59 and above or 40, these are the people have a higher propensity to develop or to be affected. Now, I want to make a hypothesis, okay, meaning a theory or a thesis for this, that in this problem today, where coronavirus is, we can be considered the talk of the town. But let us not forget about your conditions, the condition of your health today. Are you with the person with the chronic problem? Okay, let's simplify this. People with aging problem. Okay, aging problem is like, as mentioned in the National Institute of Health publication, since 2000, I think 1999 and 2004, published in the National Institute of Health, okay, National Library of Medicine, that people with aging process, meaning they are the person in the process of deterioration, meaning they are the person with low healing capacity, meaning to heal slower, okay, slowly. And they have the high propensity of getting infections and cancer. They have the problem of accumulating more fats into the blood vessels. These are the person should, okay, take note or take charge of their health today. Here is my advice. First, check, okay, not the tissue paper, no, because anything from now, according to the result, the report, that people without history of travel, people have no history of contacting person with infections, have also what affected, okay. I think of the 4 report, I think 1% or 2%, okay, people are affected with local contamination, and the history is still unclear for all of us or even to the health authorities, because there are people affected even without the history. So my first advice is you need to visit your what? Your doctor, no? Check your maintenance, check your lipid profile, your respiratory, okay? Because these are the people who, according to the report, has high propensity of what? Getting this problem, or okay, or be suspected, okay? Suspected, no, probable case, will be in the probable case, suspect case, because you have a history of this kind of problem. Because the first initial problem is coughing, shortness of breathing, fever. So people with this kind is not advised to travel or to visit any places. They are advised, according to the news, that they should stay at home, okay? So this time you will enjoy your home-based business, and also to be with your loved ones, okay? To stay and relax and do something while you are at home. Now, the second advice is you need to, advices that is good for people who has heart disease and respiratory problem, okay? Maybe previously you are advised, okay, if you are that kind of person, you are advised to eat healthy diet, okay? And you cannot do it, you cannot make it, because based on your education, vegetables is giving you problem. Eating this kind of vegetables will give you problem. So that kind of education will affect you today, because you are advised to eat healthy food, right? Because eating healthy diet is the best strategy of World Health Organization provided, okay? Eating or healthy diet is essential for protecting you from developing chronic illnesses. Many chronic illnesses, not just one, but many chronic illnesses. So here in this situation like this, we are advised to eat what? Healthy diet. But what is our problem? What makes us not be able to eat healthy diet, not be able to practice healthy diet? Because of education, based on our education. Second, based on our habit developed, based on the education we get from younger years, okay? When your father or parents cannot provide you healthy diet because of their education, then, or their habit, okay? So it's what? It's also like a virus. No, you don't know how to cook. You don't know how to prepare healthy diet. Okay, this is reality. This is reality. Maybe you only know to eat 2 kinds of food: protein and rice, or carbohydrates. Easy for you to just open a can or eat fast food, okay? So there's no problem with that if in the home, since we're talking about staying in the home as the advice to stay at home, okay, and sometimes you just visit, okay, not frequently in the crowded area today without precaution of washing hands, and be cautious of what you're touching today, and senseless of touching your eyes, your nose and mouth, and or your faces. So it's better when you have knowledge on providing yourself with a healthy diet. Now, but if you are stuck in the hindrances of you don't know how to prepare food, you don't know what is healthy diet, World Health Organization give us category or like complete set of healthy diet, like eating your vegetables and fruits. Okay, the DOH theme for 2020, I just saw it last February when I was invited to speak in Dr. Bombo, that eating vegetables and fruits daily, okay, is advised, and go slowly to salty, oily, and sugary food. Meaning we need to eat healthy diet daily. But if your concern is, I cannot prepare, you don't have knowledge, then you need to see nutritional specialist, your nutrition expert, okay? If you don't know, we have our office, Dr. Lajot Wellness, where you can get more options for better nutritional direction, okay? We will give you options, okay, to help you get more knowledge, or you can PM us, okay, and we can give you details. Like, for example, healthy diet, if you can prepare, okay, starting today, go and visit your farm or local farmers, and the best food for today for this condition is eat more food that is yellow, red, because this is good for circulatory system. For balancing your impurities, look for food that is green, okay? Green. And white, radish for infections, right? For clearing the pathway also. And for protecting your first line of defense, which is the mucous membrane, your skin, okay? This kind of food like radish, garlic, okay, according to some reports that garlic is good for treating infections, and it depends on the kind of infections. And also radish is very good for if you have problem when you are at home, okay? When you are at home, when you are at home, you need to have radish, garlic, pear fruit, watermelon, more, so that you can have more fluids into your body. Now, how to get more fluids into your body? Upon rising in the morning, okay, rising in the morning, you need to have warm water. You can mix with, if you have chlorophyll, you can mix there, okay? And the best chlorophyll we can give you, okay, for red markers, okay, you have chlorophyll splena, the best chlorophyll in the market today. Okay, you can add it in your warm water, or you can put some baking soda, okay, sodium bicarbonates. We're talking about sodium bicarbonates. You can find it in the bubble tea with real fruit orange and fortified with calcium and sodium bicarbonates. What is one of the ingredients, okay, to make your acid or pH level, and look for water that can help you, okay? So, and buko juice, buko water is also helpful for providing your body electrolytes. So that's when you are at home, right? When you are at home. And food like calabasa, orange, okay, mango, okay, there is also a dried mango today is packed, and and it's safe for you to eat, okay? And it's sold in the market. It's preserved, but the nutrients is there. Mango is rich in vitamin A. And vitamin A is good to maintain your mucous membrane. Mucous membrane is, listen to this. Mucous membrane is the first line of defense. It's one in the pinkish area of our nasal and our throat and our ears, and they are the first, also in the eyes. Okay, they are the first line of defense. That is why when you have strong mucous membrane, okay, in that mucous membrane there is also cementing and making that mucous membrane strong, and that is because of the collagen. Okay, and collagen is can be formed and utilized or formed through the help of the amino acids that you got from the food you eat. That is why be sure to have food that is rich in amino acids, and I can recommend one is spirulina. Okay, spirulina is very rich in amino acids. Okay, I think almost 18 essential amino acids is there, and to help utilize this amino acid is to get vitamin C. That is why vitamin C is very important in our diet while at home, as our home base, because vitamin C will help utilize these amino acids to make and support your collagen to be strong, okay, so that virus, okay, according to physiology, virus cannot penetrate if you have strong collagen, strong connective tissue, strong mucous membrane that is found in your nasal, in your throat, in your ear. That is why people with this kind of problem like respiratory or cardiovascular or chronic diseases, they belong in the aging population. Okay, aging population. Aging is not about the number you have. Okay, like I'm 46 and you're what? 40 or 70. Okay, it's not about that. Aging is a complex process of the deterioration process. Okay, meaning deterioration. That's why we need to regenerate our body. Okay, meaning making form and healthy again. That is our system. That's how the system of our body works. Okay, so the bottom line there is the coronavirus is already spreading, yes, but let the authorities, the CDC, the World Health Organization provide you with the right information. Go there and visit and ask for advice to them. Okay, and what I am saying here is, if you are now concerned not to be affected and be infected by this kind of virus, first you need to have the first line of defense. Okay, first line of defense. You need to protect, equip your body. Okay, equip your body, arm your immune system with the nutrients, and maintain your metabolism, because people with cardiovascular or other problem, health concern, okay, with circulatory problem has metabolic syndrome, okay, or problem or disorder. So we need to arm ourselves first, okay, and let this person inform us what is happening already in the market. But you need to be informed about your nutrition, about your health. The condition of your health is the condition of your body. Body is a complex state, physical, social, mental, and also the mental here. You need to keep thinking of the possibility and the positivity. Talk this out loud, positivity, not the negativity. Okay, and increase your faith. Increase your faith, because only Allah knows, only God knows, and what this situation all about. And this is Dr. Dorwin Lajot, and if you need, options for better nutritional directions, then PM us, contact us, visit us at Dr. Lajot Wellness. Alhamdulillah, and may Allah bless you.